All right, welcome to EMS Underground. I am Charles McFall, and there's my camera right there. Hey, and today we're joined by Terrance Ramotar of AMR, and this is what we're going to be doing today. You've heard us talk about Dekalb County and the issues, and all I've had is the news stories to really go by. And that's never enough. And AMR and Terrance were kind enough to actually reach out to us and say, hey, we'll discuss Dekalb County and the issues going on there. We're going to take live questions from Facebook. You can actually call in, and you will get our screeners today at 678-561-2368, option 7. And we're going to keep the conversation going. But what we're looking for is truth. We're not looking for controversy. We're not looking for a witch hunt. We are trying to get the facts of the matter, and Terrance is here to discuss that with us. So without further ado, Terrance, thank you for being on today.
I can't tell you how much I appreciate you guys having us.
And we really appreciate you coming in and being willing to discuss everything. And of course, Tom is here as well. He's running all the cameras, and he's got some questions. So let's give the gist of it right now. As we know, the city of Dunwoody is, well, and I've said it before, in my opinion, the city of Dunwoody is absolutely done with AMR. They wanted their fire department, they got it. They wanted their police station, they got it. And now they're working on their own EMS. What we really want to start digging into and getting honest responses from is, I guess the biggest issue ongoing has been the response times. So what's going on? Can you give us some background on what's been happening, what's legitimate and what's not as far as the response time complaints?
Yeah, so I think it's important to understand Dekalb County's EMS system as a whole and how it got to where it is today. So as we understand it, years ago, Dekalb County Fire Rescue did all of the EMS work and transport and decided to get out of the transport business but stay in the first response business. They made a conscious decision to have a dual response system where their Dekalb County Fire Rescue provides first response paramedics and EMTs to the scene of every call, and that they would allow the time for the transport units to return from where they are coming from to transport the patients. So somewhere in between then, I think there were one or two companies that they had contracted with or tried to work with to get that through. I think one was CARE and Rural Metro.
And that Rural Metro was a part of that.
And so I wasn't here at the time, but I know there was some controversy back then. So we were called and entertained working with Dekalb quickly. So at the time, we didn't have much time to get up and running. We agreed with Dekalb County to start up an ambulance service in 30 days. And we did so.
30 days.
30 days. Probably one of our fastest startups.
Yeah, that's crazy.
Yeah. So we came to provide that service and with them. Along with that wasn't much time to redesign the contract as it was, and as you've heard probably from the Dekalb County Fire Chief himself, that the contract is a bad contract for the times that we're in today. So the beauty about Dekalb County's EMS system is it's a dual response system, and that every patient gets a paramedic at their side in Dekalb County, whether it's an ambulance or the fire first response. Most of the time it's the fire first responder, within 6 minutes. And so they're treating and caring for those patients while the ambulance is on the way. So I think it's really important to understand a dual response system.
So let's talk about that for a second. So that's something you brought up to me before, because the biggest complaint is AMR response times are 13 minutes, 15 minutes, 20 minutes, blah, blah, blah. But really that response time clock does start when 911 rings, right? But let me clarify. Does it start when 911 rings, or does it start when the dispatch goes out?
So it depends from whose perspective you're looking at it from, right? So
for
us, as soon as Dekalb County 911 receives the call, they send that call over to us and we dispatch a unit appropriately. So from our time perspective, it's the time we receive the call, not the time the 911 call comes in.
Right.
We're also looking at the overall system, right, as a sum of all its components. So, how long does it take to process a 911 call? How long does it take to dispatch it to the appropriate system? And in some instances, the 911 system is a little bit different. So, in Dunwoody, for example, those 911 calls don't come into Dekalb. They actually come into a third-party service. That third-party service then screens the call and eventually gets over to DeKalb 911 to
Okay.
dispatch, right?
Which takes time.
Which takes some time, right? So, and there's technology in between to make sure that's an expedient process. So once DeKalb County gets that call, they send it over us. We send the closest, most appropriate unit.
Okay.
So that's how that works.
All right.
To your point, yes. So there's complaints about 13, 15, 9, right? So I understand. Admittedly, we know that the contract itself calls for 8 minutes 59 seconds, right? And we'll talk about the number of challenges that we have that weren't contemplated back then. Today, and that we're thinking about with DeKalb County in partnership on how that system should look going forward. So those times are all important, but
Yes,
it's part of it's a part of a system of care that needs to be understood. So, and how important is it? Not saying it's not important, but being that we have several components in the response. We need to look at that and how do we, from a patient perspective, and how do we get care to them, deliver the care, and then get them to the hospital.
Right.
So, and we can talk about the number of challenges.
Sure. Oh, yeah. We'll get to that for sure. So that is something to be understood, because I know one of the biggest complaints that was levied the first time we talked about AMR, we had some firefighters. They identified as firefighters in DeKalb. I have no way of verifying that other than they said, "Hey, we've been on scene and we're sitting there going, where's the ambulance? Where's the ambulance?" Well, that. While it's understandable, the fire department typically has people who can maintain advanced care, even, right?
Correct.
So that is issue number one to understand is, okay, 6:00 on any weeknight in Atlanta, in DeKalb County, you're getting a number of wrecks and accidents happen. And while you have, I think, roughly 20-something stations of firefighters, and you have 40 ambulances up, you're having to cross county sometimes and fight traffic. And that can be, but as long as, in my opinion, as long as somebody is there, well, honestly, as fast as they can. I mean, you can only do what you can do sometimes. But for the most part, if you're there, when you can get there, that's the fire department is first in.
Yeah, and by design, that works great. And one of the challenges you talked about is just the traffic. One of the wonderful things about DeKalb County itself, for over the years, they've worked on developing the county, and such that the tourism is up, people moving into the county is up. They've got a population they've never seen before. That's fantastic stuff. It's people love, our employees love working and living in DeKalb County. But with that growth, we've got the challenges of increased traffic. And then also one of the problems we see is where the hospitals are located. So our crews are out there responding to calls. They transport patients into hospital locations, but to get back out into the field, especially you say at 6:00 on a weekday, right? Now they're with traffic, right? They're alongside traffic, and not everything is a life and death emergency. So they use due diligence in figuring out how quickly to get there, but they're stuck as much as everybody else is stuck on these roads. So we are looking at different deployment strategies now, and I think you may have seen that we decided, in addition to increasing the hours we put on the road as part of the normal system, we're now trying station-based, location-based units that are there 24/7 for specific areas. So we've been doing that for a couple months. It's wildly successful. So we're looking at that as part of maybe what DeKalb should look like going forward.
That sounds good. So what you're saying is you're adding more coverage to the areas that need it permanently.
Absolutely.
Type of deal.
Realizing that. So a lot of trial and error, but that's one of the challenges that we've got to work with, and we've got to find innovative solutions to improve that.
Right. Now, for all of you listening, there was a glitch at the beginning, but now we have everything seems to be running just fine on Facebook. So you can type in your questions on Facebook, or you can call in 678-561-2368, option 7. So to the main Dunwoody accusation that says, the big story that they use is, there was a family with a kid with a history of seizures. He's an 18-month-old or 20-month-old, and they had to wait 30 minutes for an ambulance to take him, and that's unacceptable. I initially said, I called BS on that because if you're a parent with a child with diagnosed seizures, you're supposed to be educating yourself. The hospital's trying to educate you. The doctor's trying to educate you to give you ways to manage it. And while, yes, that kid needed to go to hospital, there's honestly, with an educated set of parents, there's nothing an ambulance is going to do that the parents can't do. The parents typically will have Valium, an auto injector of some kind, to take care of the kid. So to that story, you say, if the story is true, and again, I don't have the documentation to follow up with it, but that's the flag that, is his name Nunn? I think Councilman, something like that, yeah. No, that's it. That's his flag he's waving, because kids get attention. And he's waving that they had to wait 30 minutes. Like, why did they wait? One, the fire truck should have been on scene. That's care. And the fire truck could have advised whatever they felt good advising. If your ambulance is coming from across the county, I've recently been riding with AMR, and I've been in the back of an ambulance where we were in a territory we were assigned to. Something happened across the county that all the trucks on that side of the county were done. They were taken. They were running calls, and we were the next closest. And the GPS says 30 minutes to physically get from where we were to there. You can't magically teleport somebody. So in that particular call, how would you answer that? Where Nall is saying, that this family with the child had to wait 30 minutes. What's AMR's response?
So first of all, look, our goal is to get to patients the fastest we can. So what we do in our location in Dekalb and all over the country is continuously improve our systems. And you'll see that across the country. AMR is providing innovative care solutions all across the country, and we're trying to apply some of that here. With that said, I also want to make sure that some of the good's brought out. So last month, Perimeter Mall, 9-year-old girl, call her Sarah, shopping with her family, right? Had an undiagnosed cardiac event and went into cardiac arrest in the Perimeter Mall. And within minutes, first responders were on scene. Dunwoody Police was on scene. They started performing CPR. Within minutes, the ambulance was on scene as well. Today, Sarah is being discharged home.
Good.
9 years old, and enjoying life again with her family. Now she needs medical care, but she's here today. And that would not happen if it wasn't for our paramedics, the Dekalb County paramedics, and Dunwoody Police Department, and all the training that we provide. We have probably the most skilled workforce in the state of Georgia, not just because of training, but because of experience. So that experience comes to play in an event like that. And we have these dozens of times a day. So we have outliers. So, there are, those instances where, it is, it's everybody's emergency, whether it's a stub toe and you call 911, or it's a cardiac event and you call 911. It's an emergency to them, and that's important to us. And we want to make sure we get an ambulance there. What we are working through now is a change to the system. It's I think admittedly everyone will say that it is a bit antiquated. We are looking at how do we respond to non-emergency calls? What do we do with those calls? That's a large percentage of the calls. If we take that out of the system and figure out how to manage that and leave the emergencies to be responded to by the emergency ambulances, I think we will be moving in the right direction. Like I was telling Tom before, is that that's something that we've got to figure out. 911 becomes access to health care for everybody in every county we live in, especially DeKalb.
Yeah.
Right. So it's a transportation service, but it's also access to health care. So we do receive a fair amount of calls that are really not true emergencies. Anywhere from 30 to 40% of those calls are not true lights and sirens, life and death emergencies. So we've got to figure out how do we help those patients as well. Right. Not saying hang up the phone, call your doctor. But what I'm saying is, how can we navigate?
Don't have a doctor,
or they don't have care. They don't have primary.
The ER doctors are primary care, which is an issue.
So is DeKalb requiring you to respond lights and sirens to everything, or are you using system status management? Responding?
So a combination of both. So we do currently respond lights and sirens to most every call. And if the fire crew on scene downgrades us once they make patient contact, that can happen as well. So so that we do system status management in terms of managing the deployment and managing where units are located and making sure
Right.
they're available.
So these statistics that keep getting thrown up, is that being put in the mix, or is the media using that to their advantage?
Yeah, so I think a little bit of both, but to your point, those statistics are measured against a contract. So we're looking at what's the right system for DeKalb, and every EMS system is its own EMS system, right? So interesting. You look across Metro Atlanta, and there are different response times criteria and requirements for each county,
Yeah.
or none at all. Right, so City of Atlanta, I don't know what the requirement is there. I know Cobb County, I think it's 12 minutes. Some systems are 12, and some
Yeah.
systems are 20 non-emergency. So
Yeah.
everything is different. So there is not one standard, and that's something that was brought across the news, that there's a national standard for EMS response. And you guys have been doing this as long as I have. We don't know of a national standard. The standard
No,
is
it really isn't.
whatever the design of the system is
Yeah.
that enhances patient care.
'Cause, I mean, in Montana, you're not going to get an 8-minute response time in certain places because it's so rural, that
Right.
kind of thing. Matthew Gadis says, are DeKalb County officials/EMS providers educating the community on how and when to utilize 911? From my experience with the ride-alongs with AMR, I noticed that most people don't really understand what an emergency is. They see blood and think it's an emergency.
Yeah. So we've started campaigns to address that. One of the things we're doing across DeKalb County is a program called Safety Jam. We're doing a couple times a year throughout the county. We're inviting the community in to learn about how to prepare for disasters. 2-minute CPR, two-handed 2-minute CPR classes. And what are true emergencies? And what you'll see over the next coming months is more of that, more of a community education effort to let them know what's a true emergency and not.
I know that we helped y'all here with CPR Saturday to do,
Saturday.
teaching. Y'all were doing it there in DeKalb County, and we extended it here as a facility too, to teach people to do, what to do in those first few minutes and do the hands-only CPR. I know that you've been working with children to get them into the Explorer program, which had pretty much died in DeKalb County, which is a great program. And you've gotten the Explorer program back up and running, training children to get into the fire service or even into the EMS service, and teaching them how to handle life-threatening emergencies as well.
Absolutely.
And that's a great thing. And those are things that are not getting published in the media. It's just, response times. But there's a lot more things that go into a response time than just an ambulance getting on the road and driving to a call. Is it rush hour? Well, you know what? The DOT has a part to play in that as well. Where are the units? Are the units stuck at the hospital? Because we've got units going to these hospitals, and nobody is bringing anything up about the hospital's responsibility in this. Because I know for a fact that you've got ambulances, and it's not just AMR, it's all the other services out there too.
Absolutely.
Have got ambulances going to these emergency departments, and they're sitting in the emergency departments up against the wall for 1 to 2 hours. And they can't run calls.
Well, I'm
And
glad
they
you
have to
brought
sit
that
there.
up. That's a major problem in the Metro Atlanta area, not just for AMR, for every other ambulance service in that area. And it's not a point finger game, because the hospitals are overcrowded as well. You've got ER overcrowdedness. Right now, I can tell you that the time it takes to discharge a patient and get back in service is averaging 1 hour. 1 hour. So you all are providers like I was. Standards usually 20, 25 minutes.
It depends on where you work.
Depending on where you work, okay.
Yeah.
So what we said in DeKalb is, let's measure the time it takes after 40 minutes. Let's be very conservative and say 40 minutes we own, okay? Because things happen, right? Or the crews need a break. They need a little bit of downtime. They got to do their paperwork. Let's make that the standard. So the time outside of 40 minutes in the month of July, we had 1,600 hours. sitting in ERs.
Wow.
1,600 hours. I did a little math, and I said, if you take the number of calls we receive, right, and look at the 1,600 hours, how many minutes would that put back into the system per
Right.
call?
Right.
8 to 9 minutes per call
You would shave that off of each call.
would be shaved off.
Okay.
So,
Which
know-
really would actually have a cascade effect, because once you get 10 trucks, 20 trucks back into the system 10 minutes faster, then those response times really shrink down because they're more available, and you actually would see a cascading effect
absolutely,
there.
absolutely. And I've always said, look, we don't think there's an ambulance problem. We think there's a system problem, because all of these components, from the time you call 911 to getting into an emergency room and them being able to accept you, is all part of the system. Mathematically, we put more than enough resources on the road every day to handle the number of calls,
Yeah.
and anticipate 40 minutes at a hospital. But when we're, and you've done some ride-alongs, you can see we experience what we call wall times in this area. We experience wall times 3, 4, 5 hours. When I say
crazy.
because I say 1 hour is an average. So
Yeah.
think about that. Doesn't necessarily mean the middle.
Well, okay, so let's talk about that for a second. If you think about it, my experience has been, and you have more experience with it, is that we'll use DeKalb main campus as the example. You pull in, there's already four to five trucks in the bays. At worst, at the most busiest time, the whole bay is filled, which I think is 6 ambulances, 2 on the side, that's 8, 2 on the wall, that's 10 ambulances. And they're all in there doing something. So on average, there was always 4 to 6 ambulances when we're there. You walk in with your patient, and there's already 3 patients on stretchers and 1 in the triage room. So even if stuff's available, rooms are available, you're in line because there's a bottleneck, right? There's a triage nurse that has to see them. They're moving as fast as they can, and then they either go to a room or they come back out the hallway to get that room ready, and they're trying to move. That's just a natural day when you're just moving people through. So when you're talking about an average of an hour, you are talking about just the standard of waiting in line, seeing that one nurse, and then she has to hand it off. And everybody does what they can, it seems like, on a human level to make that a little faster. Like one of the medics will go to the registration desk and go ahead and get them started in registration while the other one is getting triage done. But when you have 4 people in line, you're going to have to wait your turn.
Absolutely. And, the hospitals are facing the same problems we are, right? It's, do they really belong in this emergency room? Could they have got to a primary care physician or an urgent care center?
Right.
Those sort of things. And that's part of what we're trying to do is urgent care centers are popping up all over the place. So, how do we connect those folks to the right level of care at the right time?
And there's something else I want to bring up. We have a question. DeKalb County's call volume is usually higher than available resources. Even if there were 60 units on the streets, there would be 5 calls holding due to non-emergency dispatch calls. And often units are held up due to ER overcrowding. That's from Trey Reed. That goes along with another comment that's already scrolled up. I did see that somebody said that when they worked in DeKalb County from 2012 to 2016, often the fire department would call a med unit out to do a refusal, which really wastes time on the med unit when they can be doing another call somewhere else. The indication was the fire department knew it was a refusal,
right,
but the med unit had to come out and say, okay, we checked you out, we got some, sign this paper.
5 years ago, perfectly acceptable. And that's why we're working with DeKalb County today to take a fresh look at this system and some of the traditions within it. So I actually think it's despite all of the negative media, I actually think it's an exciting time for DeKalb County because I think you have the right leadership in place. I think you got the right thought processes in place to really redesign that system going forward. It's really and really excited about what it can look like and the opportunities ahead.
Yeah. On that,
So,
quick, on that 3-panel, if you swap our cameras, it'll look like we're both looking at him. That'd be awesome. The one that's over. What were you going to say, Tom?
I think that we're getting a lot of comments here about the wait times at the hospital, and one of the main things I wanted to point out for today, because I hear all these arguments about, it's AMR, it's AMR's problem or AMR's fault, and it's not just AMR's fault. Is there things that probably AMR could do better? Yeah, but that's any business. Apple computers can do things better. That's not the point. But it's a system. It's the entire system that that needs overhauled in DeKalb County. It doesn't matter, and I'm going to say this from a political point, it doesn't matter what service you have sitting in DeKalb County, there's going to be problems until the entire system is fixed. If you look back at the history of DeKalb County, every service that has been responsible for running ambulances in DeKalb County, including DeKalb County itself, has had problems running calls in DeKalb County. And until the system itself is fixed, which means, what are we responding to? Where are we responding to? I know that you've got patients in DeKalb County that are going to DeKalb and they've burned up the ER so bad that they don't want to go to DeKalb.
They want to go to Northside
They want to
or
go
St.
to, they want
Joe's
to go to
or- yeah.
Kennesaw. They want
Yeah.
to go to Cobb County. And that's taking your ambulances out of the system for hours. And then we've already brought up, we've got things, and I'm saying exactly what you just said here. The people are coming up and they're saying, yeah, we've had to sit on the wall for 5 hours. 5 hours, that is ridiculous, for 5 hours to sit there.
Yeah.
And at that point, understand you want to go to the hospital, but maybe we should go to another hospital that's not a
Yeah.
5 hour wait.
Look, and
And I've seen your medics say, okay, I want to go to the cab. Well, the cab, what brain was on diversion.
But-
And they're like, well, we're literally 5 minutes from Hillendale. It's the same system. It's the same type of doctors. And, well, I don't. And they've heard things. And they being the patient, doesn't want to go to Hillendale. They want to go to cab. Well, we literally can't take you to the cab, man. You don't meet the criteria to override diversion. So either we can go here or we can go to Northside or Emory or,
Yeah.
And that is a problem.
And there's a delicate balance between patient choice, right? Keeping them within their system of care and where their physicians have rights and privileges,
Yeah.
versus what's effective for the EMS system.
But understand, I've always been a proponent of you have a right and privilege to go to the hospital you want to, but when it's a non-emergency, you should go to the closest appropriate hospital. But if that hospital is overwhelmed, well, then you go to the next closest appropriate hospital.
Absolutely.
Because if it's not an emergency, then you should be able to go to your primary care physician. Have you tried that? I know in my career I've gone out on so many calls, and it's like, I've got a headache. Well, what have you did for your headache? Have you taken any Tylenol? No. Have you taken any Motrin? No. But I want to go to the hospital.
Well, I've worked in the hospital where I was a triage medic, and they'd come in with that headache or something. It's like, well, have you taken any Tylenol? No. I said, it's flu season. Everybody out there has what you have. Why didn't you do anything? Well, well, that's not your business. Okay. I mean, you can't. I don't get in trouble for asking questions.
Right.
So I'm going to ask a question. I'm not going to kick you out of the ER. You're going to wait for 6 hours
Yeah.
to see a doctor, but. Why just go home and take some Motrin?
Yeah.
But
We'll call me an ambulance to get me home.
Yeah.
But are the hospitals participating in this whole thing? Because to me, there's got to be a solution. You're going out on somebody that's got a bellyache, who could have went to the emergency room, who probably could have went to urgent care, who probably could have went to their primary care physician, but they don't do that, and we know that. That's just the system. It's been that way since I've been doing it for almost 25 years. Charles has been doing it 20 years. It's been that way from the beginning. People are going to always call 911 for stuff, and you're shaking your head like, okay. But whenever I remember, like here where I used to work, if we came in and it was something that was completely not needing to get a bed immediately, we took them to triage. And the triage nurse
you walk out
triaged
front.
them. We took them to the triage nurse. Triage nurse did a vitals, got a history, got everything up, just like if they would have driven themselves to that hospital. And then they sat down in the waiting room with everybody else, and we went in service. I mean, but that was here. Whenever we would transport to Atlanta hospitals, they wouldn't let us do that. They'd park us on the side of the hallway, and we'd sit there for a long time.
Yeah, and we've worked with DeKalb Medical Center, and they recognize the issue. And matter of fact, in December, I believe it's another 20 beds in the emergency room that they opened up.
Okay.
And so until that time, what we did in partnership with Dekalb Medical Center is actually put a paramedic in their hallway.
I'd heard that.
Yeah, we staffed a full-time paramedic in their hallway.
Because they could take charge of
Take charge. We put extra stretchers in
right.
there. And then Dekalb said, well, we'll match that, and we'll put, once we hit a certain number, they've added a nurse and a couple other beds.
So but that medic's not there now. What happened to the program?
The medic's back on the street running calls. So, we needed every paramedic we could
I got you.
to run. But also, they did free up just a tad bit. But I think they put a dent in it. They put a dent in the problem of the overcrowdedness and the overuse of the emergency system. We're also looking at doing quick response vehicles and helping to get.
Okay, so that pop up as a question.
So we're looking at that. We've got a couple trial units out there, seeing how they work. Dekalb County is actually adding some of those units themselves. I mean, look, I think at this point, as you can tell, it's been years, and finally time come that we've got great leadership in place and a great body of knowledge in place. Chief Fulham is probably one of the brightest chiefs I've ever met. Hired a consultant to add to the mix. There's a study underway. There's actually another one done last year. We're going to have enough data. And like I said, what's really exciting is really taking an innovative look at the system and changing it for the better.
I got you. I do have a question to ask, but I remember going through, I can't remember if it's EMT school in 96 or if it's paramedic school in 99, but I remember we were studying different cultures of medicine. And Japan, the medics aren't on the ambulance. It's a doctor and an EMT is on the ambulance. The medics are on motorcycles with we'd have an AED now, but you have many monitors and drugs, and they would shoot to the scene. I was like, I want to be that medic.
We're not doing that in Dekalb.
Okay. No, but I'm saying you should, because I want to get on that motorcycle.
I love our paramedics too much to do that. But to your point, it's every system is different. Every system has to be built around its challenges.
Right.
We have some systems where we're the only provider, the only ambulance to respond, and so in those systems, it's 9 or 10 minutes or whatever that is there.
Right.
Dual response systems, they take a look at how what the components are and what the time expectation is for that. Nice. And so again, fresh look at the system. In the meantime, we're buffering the system to allow time for those studies and those thoughts and processes to occur.
Well, on that note, Tone writes in and asks, you keep talking about the system in the cab. Can you be more specific on how you're working with the cab to improve the system? I know you're talking about the studies and you're buffering, but what is it that you guys are taking steps immediately, midterm, and maybe long term?
Yeah. So something you mentioned before, right? We're putting more units on the road than are necessarily required. Have we seen an improvement in response time? Absolutely.
Good.
It's not getting where we want. Well, we want it there in a minute. Okay?
Sure. Yeah.
So
2 to 5 minutes. Yeah.
Right.
Yeah.
So,
fast.
but putting an ambulance every 5 miles still doesn't get us 9 minutes, right? But it's getting us to a better place to get patients to hospitals and get the first responders back in service to the next call. So we added those hours. We've actually added, like I said, station-based units across Dekalb County that are specific for those areas because some areas are sort of like islands of the county. They're kind of isolated by traffic. They're far away from closest hospitals, so we're putting station-based units there. In the meantime, as we look at improvements to the system. But beyond that, we're bringing all this data to the table and working with Dekalb County to show them things that we do in other parts of the country. They're gonna look at their consultants and, like I said, all the brains are coming together, looking at how we dispatch calls. What do we dispatch to what? Do we need to go lights and sirens to every call? What about these what we call alpha level calls, or the low acuity calls? So those aren't true emergencies. So what can we do? What can we do with that? And that is an active process right now at this minute. And actually, we'll start to do some trials here shortly.
So let's clear up a point real quick. Only the city of Dunwoody that's making all this ruckus. The DeKalb County itself is happy with AMR, is willing to work with you on making the system better. Is that a true statement?
Yeah, and vice versa. we want to work with them.
Well,
to
yeah.
make the system better.
Well,
But-
that's the assumption.
Yeah,
is that
you know,
want to make it better.
so today the average, you can use whatever metric, and I talked about. There's no standard, right? So there's a misnomer out there. There's a NFPA standard of 859. Well, I think the system's built to get a patient care within that 859. Not necessarily transport unit, but today, as it stands, it's we're averaging about 10 and a half minutes to every call. Are there outliers? Absolutely. So that's what we're doing is we're putting solutions in place to deal with the outliers, and we're responsive to the community. I mean, yeah, we've got complaints, people that are more vocal about a 38-minute response time to a psych patient, and every patient needs to get to where they need to be, quicker.
You always have to prioritize in a system at some point because psych patient is a legal issue, right? It's a threat to public safety. It's a threat to their own safety. Once they've harmed themselves or somebody else, the other person is our patient or they are their patient, depending on where the harm is. But yeah, that was one of the calls that got thrown up in the last meeting, right? Was the city chief, Billy. I just like saying it that way because it irritates me. That he got up and was like, my people had to take a psych patient to the back of a cop car. That's where they belong by the definitions of how we're supposed to handle that in the state of Georgia.
Right, and we've got to, we have to understand what the medical concern is. And like I said, look, we want to get there. We want to get there quick. And even Chief Grogan wants his policemen in service again, quicker, or the firefighters want to get back in service. So we are working towards that. And what's interesting, it's a DeKalb metric, and if we compare that to how the rest of the area runs, you'll find apples and oranges all over Metro Atlanta.
Yeah. Now, Michael Kern has a suggestion, which actually is going to lead into something you were telling us before. He says maybe have a medic in dispatch to screen calls. Well, first I'm going to address that directly. You don't want a medic in dispatch because the state of Georgia doesn't recognize that level as being high enough to discern, blah, 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 blah. But I do know that I want to say it's the wrong county. I keep saying it's the wrong county. So it's a county that is working with us to recruit our students. They were talking about having a nurse or a nurse practitioner even in that system to help discern calls, that kind of thing. And then you brought up somewhere else that AMR is trying that system.
Yeah. So in Washington, D.C., really we've been an integral part of their system, and likewise helping them to transform their system into the next generation of EMS. So what we're doing there is providing a nurse navigator in the 911 center who is triaging those calls. They're taking those alpha, low acuity calls and figuring out what to do with those calls, whether those patients need to go to urgent care centers or maybe it's okay for them to schedule an appointment with their doctor the next day. But those calls are being routed differently, and I think that's the biggest change we're making in this industry, maybe within the past year or so, where those types of innovative solutions are being provided. In some systems, we're working with Medicaid to figure out how can we get non-emergency transportation for these folks that have activated the 911 system, and really, it's not a life and death emergency.
So what about like the community paramedic program? Have y'all thought about that?
Yeah, so we're doing that in a number of locations, and that's something we want to discuss here. Not a whole lot of systems or insurance plans actually pay for that.
Right.
So financing that system is a challenge. But sometimes it pays for itself. And that's something we're looking at here in the Metro Atlanta area, is working with different providers to provide community paramedics or mobile integrated health services, going out and preventing those recurring 911 calls or even those readmissions to hospitals.
Yeah, there's so many problems in the system, and the thing that keeps popping up, we're like, well, what about nurses? What about medics? What about these programs? You can still game the system. All you have to say is chest pain, and you may not want to speak to direct numbers. I'm not sure where it stands for you as a company man, but from the streets, I could tell you there's a common problem at DeKalb County main campus, the DeKalb main campus hospital, of them not wanting, the patients being them, not being seen fast enough from triage, and they will walk across the street to the CVS and call 911 with chest pain or difficulty in breathing, thinking that it's going to get them now to the back door, and the medics routinely show up, so you have to go, and you have to go license sirens, And even though they know that CVS is the hot spot for where people call from, you have to go. And then the medic plays it by medical standards at that point. And it still doesn't get them in the back door. But that's the thing. You can put the highest educated doctors in the world in dispatch. If somebody says, I got chest pain, how are you going to differentiate? You got to go.
Yeah.
Right? What do you do about that kind of thing?
Right. Yeah, that's something we're looking at. And we're in a society today where services have to be provided now. It has to be at your fingertips. Information has to be at your fingertips, and that's something that goes hand in hand with our community education. Some of it I don't think we'll ever prevent. It's just going to be a natural part of the system, but we need to work on ways to reduce the overuse.
I get it. Now we got another one. This one actually I want to throw to Tom. Misha Pinkston says psych patients and DUI patients that don't have injuries should be a law enforcement issue, but it's often put on EMS, creating long on-scene times and hospital times and keeping units out of service. As somebody who's dealt with the state level, obviously you run the school for education level, what is the actual definitive line on that with psych and DUI with no injuries? Is that just a legal issue? Is it a medical issue?
It depends on what the patient's want. If the patient wants medical attention, then we have to provide medical attention to
But
them.
if they're not hurt, there are no injuries, what's the medical attention for?
We can't determine that. I mean, if they're wanting evaluation at the hospital, then we have to take them to the hospital.
Yeah, so
But the officers can't take them. I mean, if they say, I want to go to the hospital,
That'd be the police department's
they're
call. But see, the
protocols.
police department's not going to want to get involved in that, because if on that chance case that it does go wrong, and it has gone wrong for them in the past, now they're liable for it, and then the community comes down on them, especially in these times. Could you imagine what the headlines would be? Patient wanted to go to the hospital, PD refused to call an ambulance. If only an ambulance would have came.
Yeah,
Sure. I would see that. However, but once that is invoked, PD needs to step back and let us take over and transport that patient, not keeping them on scene. I know in my career I've been on scene with DUI patients that have been in accidents, and they want to get their blood drawn. They want to get their investigation done. And we're like, look, we got to go. We got to go. We got to go. Mm-hmm. So, and a lot of times, whenever we've been real busy, all I've did is said, look, we've got calls holding, we got to go. And they're like, well, we'll do the rest at the hospital. That's here. I'm pretty sure in metro Atlanta area, it's worse off.
Yeah, so the Region 3 EMS Council was charged with looking into this complaint that came out of Dunwoody.
What is the official complaint that they're looking into?
Not exactly. So extended response times.
Okay, so it is just
Let's
they're
call
not
it that,
responding
right.
to their contracted time.
Sure. Right. So, what the good thing the council did was invite all the cities to the table to meet with the council, to meet with a subcommittee, including us and Dekalb County Fire Rescue, to discuss the vision for EMS. And so these cities within Dekalb are at the table, and what will be exciting is to hear how they can be a part of that system, how they can help. Can their police departments assist? Can we look at the protocols with psychiatric patients
Right.
and decide, well, where's the line, right? So they're at the table, and like I said, the Region 3 EMS Council has charged a subcommittee with looking into the vision and assisting DeKalb County with improvements to the system. So we're all expecting a good collaborative effort out of this Region 3 Council, and nothing but good. I think they're going to allow DeKalb County's consultant and data and all these reports to come to the table and assist with the minds at that table.
And let's paint a picture about DeKalb County physically, because I've lived here a number of years, here being the Conyers-Covington area, which touches DeKalb County. Honestly, didn't deal with the county itself that much, and I was kind of under the impression, well, Decatur is DeKalb County. That's basically it. How many cities are in DeKalb County?
I actually don't know the number of cities.
But would you say it's more than 3, more than 5?
Oh, absolutely.
Yeah,
There's
more.
Yeah, there's 8, 9 cities.
Wow, okay.
Or subdivisions.
Yeah, I mean, some communities like Fourth
subcommunities.
Ward is
Yeah.
not a city per se, but it's an area in
Yeah.
They have a lot
Midtown.
of cities. I
Yeah.
mean, you got Clarkston, you've got Decatur,
Mm-hmm.
you've got Stone Mountain. was it Dunwoody there?
Yeah, City Dunwoody. Yeah. So
Brookhaven.
Is part
Is
of
Brookhaven's
Atlanta
part of
in there?
DeKalb?
Brookhaven's part of
Is,
DeKalb.
Okay.
is Atlanta in DeKalb County?
There
a
is
little bit?
pieces of
Is
Atlanta in
Yeah,
DeKalb
some of
County.
Midtown's in DeKalb County,
Yep,
right?
Correct.
Right. So I was surprised by Midtown being in DeKalb County
Yeah,
because, so you're ranging from way outside the perimeter on I-20, right? Where's the bottom part? Lithonia's in DeKalb County,
Lithonia.
right? So that's where the mall is, which is our border of Conyers and DeKalb is Lithonia.
Right.
All the way up to Stone Mountain. You said Brookhaven, which I know from my house in Conyers is a 35-minute ride. I drive every Friday night. It's 35 to 45-minute ride without traffic. So you're spanning a huge geographical area now that I was uncomprehending of that span.
Yeah, and that all goes into play into taking a fresh look at the system. And DeKalb County Fire Rescue ourselves and the consultants looking at geography and looking at how we traditionally deploy ambulances and if that's the right method. But like I said, trying different things, putting station units in different areas is becoming part of the solution. And like I said, we're seeing a significant impact.
And I got questions we're going to get to on the Facebook, but one of my other questions to you is, it seems to be CBS is the one that is really pushing this out there. That's the stories I've been seeing. Are any of the other local news media outlets reaching out to you? Are they running stories?
I've had a couple. They ran it once and said, "Okay, good luck." but no, well, you're right. I mean, there's one particular station that is. We're always getting requests from and being put on a showcase quite frequently on one particular station. Yeah. But look, there's lots of news to go around. But at least this one is one that's being solved.
Yeah, and there's some people putting up other cities, Chamblee and Doraville. There's a lot. There's a
lot
more.
There's a lot of cities.
I knew West Avenue, and somehow by fate, every time I've ridden in AMR, my station keeps being West Avenue, more or less. And it's an area I'm somewhat familiar with anyway, so it's fun. And then I'm surprised at how many times we get on I-20 to go somewhere. And then, of course, we're in Midtown we were there for AMC. Is it Sunland Medical Center? Yeah. It used to be Georgia Baptist, and we're leaving, and we catch a call, and it's down the street. I'm like, what do you mean it's down the street? This is, in my mind, this is way far away from West Avenue. Mm-hmm. And we caught the call because that's how I found out it's still part of DeKalb County. It's like, wow, that's crazy how big. So that's something that's not being presented in the news stories is the space. I mean, you're talking about 42 ambulances, I think, on average is what's running now.
Yeah, we're pushing 50 now.
50 now. And you still go NAT, which is no available trucks sometimes.
Yeah.
Not nearly as often, obviously.
No. And that's...
But when you do, just because you have an available truck, they may be on the other side of town.
That's true. True.
But thank God we have a first response system.
Yeah, which again is the police and the fire department, specifically the fire department.
Fire department, and there's medical care being provided to a patient while the system regroups.
Yeah. Jody Woodsmall Englehart, sounds like a knight of the old republic. Richard Bears ask with growing population and contract renewal upon us, what's the next step for AMR moving forward overall?
So currently has been put out in the news. This is the last year of our contract. We are working with them. Absolutely, I think everyone agrees that we're not going to do the same contract going forward. Yeah. But we're working with them quite rapidly to design the next system. DeKalb Fire has engaged expertise in that and looking at all the data. Now the council's involved, so I would expect that the next iteration of this would be a change. Whether we need to provide service until that time happens, or we can do it quick enough. But we're a part of the system now. We hope to continue to be part of the system. We've got some of the best EMTs and paramedics around Metro Atlanta. I mean, the types of calls that they run, we don't see everywhere else.
A lot of them are our graduates.
And a lot of them are graduates of the Georgia Institute of EMS. But they do a phenomenal job, and one thing you can't take for granted is the quality of care that's developed within a system. Right. So these guys have been here for years. And the care that they provide, they know these patients.
They know the streets.
Sometimes they know them by first name basis.
Yeah,
Right. But yeah, they know the streets. These guys can handle these serious calls with ease, and I can't speak enough about our staff. They're just an amazing group of people, continuously positive, always supportive, and we return that as well. And if anybody else
Good.
wants to come work for AMR in any one of our locations, www.amr.net.
We'll put
So
that up there.
one of the things I did when I started to do my research on the first story that came out was because I'm all about facts and truth, and I know from history there's no such thing as news anymore. It's entertainment, and they only tell you
they
what
spin
makes
it
it
their
sound
way.
good. Yeah. And I do know that there was a greater issue in 2016 and 2017 with response times, and I had to piece together some of this myself mentally. But what reason I know there's an acknowledged problem is because AMR being you guys put out a call for medics and EMTs in a massive hiring fashion mid 2017, and maybe you have some numbers, maybe you don't, but I know I saw from a standard EMS hiring process is roughly, depending on your trucks, you're always hiring for one truck extra. Almost always, because somebody's leaving, getting sick, whatever. So one truck extra. You were constantly, I mean, you went from, I don't know the numbers, but let's say you went from 20 trucks, and we're hiring for 5 all the time to back that up, to now we're actually putting out this many, and this many, and this many. And it takes time to get through that process. And I found out recently your orientation is like 2 to 3 weeks long to make sure everybody's knowing what they're doing. So with that being said, you grew in 2018 in January. It was one of the responses I think you had that was published. And I don't have it memorized, but it was before this news story came out. In March or April, I found a news story that said the statement was, we've hired and put up X amount of more trucks. Now we're up to 30 trucks now, and we're still hiring to get more trucks and more trucks. Which I said, well, this is some hot crap right now from the news media and from the people rattling their sabers, because obviously you acknowledge there was some kind of issue, and you dump the money, because it's a lot. People don't understand cost of acquisition. It's a lot of money to get one person put on a truck or in any hiring situation, much less the massive. I think the last number I saw, and this is again months ago, y'all hired 40-something new medics and EMTs and put them on the street, which is a huge number. And that was in a 2 or 3 month span from the end of 2017 to the spring of 2018.
Yeah. Actually, I think it was 60.
60, okay.
Between that. So, between we continue to do this today. We have sign-on bonuses for anyone coming on board, paramedics and EMTs. We're working with schools. And then when they come on board, like you said, we're making sure they get the right training, right? So, we're not a fly-by-night operation. We've got to make sure that we've got the highest level of clinical care out in the streets every day. So that requires not only just the orientation, but an intensive ride program where they're being observed by a field training officer. And not until that field training officer says, I'm comfortable with this paramedic being in the street on his own treating a patient, will we let them go so they're completely comfortable. So we provide an environment for our paramedics that they're comfortable and they're happy with what they do. We continue to look for improvements. Look, these guys work hard. They really do. Like I said, I can't tell you enough that we've got the best EMTs and paramedics in Georgia.
With the response times and everything else, it is comparative. So one of the documents that we looked up had, I think it's 2016 numbers, but it showed Cobb County was doing 13 to 14 minutes. Gwinnett County was doing 11 to 13 minutes. DeKalb County was, you were falling right into those big county numbers of response times on average for the year. They took all the calls, they being, I guess, the state board or whoever conglomerates all this information. So that was up there. Are you talking to any of the other counties? Is DeKalb County, is there a talk of any kind of coalition of, let's get leaders from these bigger counties in Georgia to define a good standard response time that can be agreed to and held, or any solution? Or is there any kind of collaboration with outside of DeKalb County to figure out a solution?
Yeah, I think the collaboration and solution part is a product of the regional council.
Okay.
So then that's where all the great minds come together and make decisions. I do think that there's no standard across the board. Every system's different. Counties are willing to pay for different pieces of
Yeah.
the system or not, and then figure out how to put those pieces together. Some counties are going to do all ALS, single ambulance response, and we'll pay for it. Right. Some will say we'll
Yeah.
pay for first responders. Let's contract out the ambulance side, put together
Yeah.
a system that works. So again, no defined standard across Metro Atlanta or even across Georgia.
Right.
You've got rural counties that they've got two
Yes,
trucks, right?
yeah.
If they've got 5 calls, okay, and they've only got 2 trucks, we're all on the same boat. We just
Mm-hmm.
have to figure out how to get solutions.
I know you did too, Tom. I worked in a county called Jasper County, and it's very rural. It's very sparse and spread out. And there was literally, if you looked on the map, ambulance is here, and you could draw a straight line to where the call would be. But if there's literally no road to connect that. So the city truck would have to come up and handle that call, because if we handled it, which we're the physical closest truck, period, we'd have to go all the way to the city and back up. And that was the only way to connect. And that's a 30-minute response time. From the city, it was a 15-minute response time. Same way going south of the county. Newton County here,
Yep.
you go to the bottom end of Newton County, the closest truck is still 10, 12 minutes away
Right.
on a good day. So you can't have that 8 minutes is a universe. That's just I don't know where it's come from, but it's a mistake. It's a misnomer.
How are the other counties helping y'all? Like whenever you go out of service, because I know in the services where I've been part of, we've had mutual aid contracts, and if we get overwhelmed, other counties would come help. Are other counties helping you out?
Yeah, to some extent, and also our other operations are helping ourselves out as well. So we've got operations in North Fulton. We've got ambulances across Metro Atlanta doing non-emergency work.
Mm-hmm.
We leverage those resources during key times to make sure that every level of service is provided at a reasonable time. But it's takes a village.
Yes, it does, and especially in like Dekalb County. My whole stance has been, since everything's always popped up, is that it's more than fixing one problem. It's more than one issue. There's a lot more pieces to this puzzle that need to be addressed and fixed. Because if the council came in and said, well, we're going to go with Grady's going to have the same problem. It's going to be the same thing. And next thing you know, CBS News is going to be on Grady. Mm-hmm. Just like they were on CARE. Just like they were on Rural Metro. Just like they were on DeKalb County itself.
Yeah. And the reality is, who's the whipping boy today? Sometimes it's Grady Hospital. Sometimes it's DeKalb Hospital. Sometimes it's the 911 system. Sometimes it's the police department. Right now, the whipping boy is AMR in that particular county. And because you don't hear about South Fulton. You don't hear about the issues going on there, and the fact that there's 4 private ambulance services. Oh yeah, we hear about it
all the time.
But yeah, I'm sorry. What do you?
So Grady took over South Fulton, right?
Right.
And AMR
But
vacated.
they can't staff it.
Yeah.
Well, they can't staff it. There's up to at least, I know, 4 private ambulance services that are backing them up constantly. Whereas I know for a fact, I don't want to speak out of turn, so I'm going to say what I do know. I do know there's one private ambulance company that has a truck dedicated to running 911 in Fulton County, because even though they don't have the contract, they know they're getting those backup calls constantly. So they staff that truck 24 hours to just do 911 South Fulton.
Yeah, it's become sort of a piecemeal system.
Right, but you don't hear, what I'm saying is you don't hear about that in the news. They don't talk about
and
that.
we're not necessarily sure that the service improved either. So, but it's a problem. And like you said, we don't have faster ambulances than another ambulance company, right? They all go the same speed, right? The same employees, right? And we all try to take good care of our employees.
And that's the other thing too, right? When a change happens a lot of times like that. So let's just pick South Fulton. Now I know it's a little different situation because AMR is a huge company. I know a lot of people actually stayed employees and moved up. But in a smaller county, whenever a change like that happens, the staff stays the same. It's just the logos on the truck changes and the management changes, but it's the exact same people. They put on a new shirt and they run it. So you're not literally changing the mechanics of the system. You might be changing a different way to manage people maybe, or a different way to approach something. ProCare, not ProCare, Rural Metro, sorry, that was there right before AMR.
Okay.
From talking to some people, maybe not all of them, but a number of I keep saying Procast, wrong ambulance service. A number of rural metro employees who were in DeKalb changed their shirts and became AMR employees in DeKalb. Right. So the solution changed in how you manage the system or what resources you brought to the table, but it didn't change the people. I'm not saying the people are the problem. I'm just pointing out to the public that it's not like a store shut down that was a mom and pop hardware store, and now it's a Mexican restaurant with all new everything.
Right.
It doesn't work that way.
We didn't
in
open
EMS.
up a Mexican restaurant in South Fulton.
Exactly.
So, which may not be a bad idea some days.
I was
But
just starting to
all
think
of
about
our
tacos.
all of our staff in South Fulton, have worked with us for a number of years. So when that change occurred, they did have a choice if they wanted to go on. We as an industry across the country and in Georgia here are facing paramedic shortages. Right? It's
been that way since I became a paramedic.
It's not a secret.
No.
So one of the things that occurred is we have jobs for everyone. And they decided to stay with us and retain their benefits and the environment that they work in, and we love them for that.
Which
but
says a lot about the company.
I hope so. And we try. We love our folks. We're all one team. And our guys, bless their hearts, I get phone calls from folks on the street, and we just talk about problems and issues, or even just for them to vent. And they love working here, so they stayed here, and we had places for them in DeKalb, and other areas that we work in down in Troop, and so most of them stayed, and we encourage them to do whatever
One thing
met their
somebody
needs.
is asking about for you to work out in your new contract, though, cooler uniforms.
So, okay, all right. Fair enough.
That's what they put in here. How about
Fair
some
enough.
cooler uniforms?
Uniforms are part of the contract, and I'm glad you said that, because we'll take note of that. There are other choices, especially in the middle of the summer here. But we could absolutely take a look at
remember
that.
those
I'm glad that
days,
was brought
yeah.
up.
As long as it's not polyester. I worked for a company that their whole thing was polyester shirts, polyester pants, and I want to call them spats, but basically Sunday dress shoes that you could shine. That was very slick on the bottom. I'm like, on paper this looks good. A photo looks good, but that's a horrible uniform to have.
You're in the ditch. That's
You are,
not
yeah.
good.
Give me my boots any day.
You want a comfortable uniform, but you also want a uniform that when they walk into someone's house,
It looks good.
It looks
it looks
professional.
good, and they have that level of trust, right?
Yeah.
So,
I've never been a fan of for an EMS uniform, a polo, because I just feel like a bunch of people came off the golf course and trying to sell me insurance or something. I do like this is why I wear these most of the time. I like this, but still, it's but that's fun. I like that question. The cooler uniforms. So let's talk some ugly truth questions.
Sure.
Right. AMR is a private company,
correct.
which means you're a for-profit company.
Correct.
Was some of the issue in staffing or putting up trucks when you came into DeKalb, was it perhaps part of the problem that Dekalb County was not offering enough to cover all the trucks?
So for all of our operations across the country, they're standalone, right? There's no mothership of grand money coming down.
Right. No, everybody has to make it on their own.
Everybody has to make it on their own. They're all
Right.
really independent business units.
But you have to make a
it's
profit.
fun.
Even as a county, you kind of have to make a profit. But a lot of times EMS is a loss leader.
A profit's nice, so some systems, have something healthy. More and more of our systems are seeing single-digit margins. So yes, it is really tight. So the money that we can get out of the system, DeKalb in particular, goes right back into the company, goes back into the business unit, goes back into the employees and their future polos. But so that's another piece of the pie that we're looking at is are the rates right? What we generate from insurance reimbursement out of DeKalb County, what can that buy? And if the requirements are here, but the money produced is only here,
Exactly.
there's a gap.
Exactly.
And how do we solve that, right? So is it in service and bringing the service down a little bit, or dividing it up and making sure you have high service in some areas, low service in others? Is it a subsidy? Is it any one of those combinations of those things that would be
People will bring that up because you're a nationally traded for-profit company that's on the stock market. You got shareholders. We got to make money. That doesn't matter though, because if you're county-based ran, they have to make money too. it doesn't matter what service is there. That's not the issue here. And you have every right to make a profit. You have every right to make money to at least pay for it.
Well, I'll tell you this.
It's like paying your bills at home. If you don't bring in the money to pay the bills, you're not going to be around
It's the same.
anymore.
I've worked for hospital-based services. I worked for nonprofit services and for-profit services. And guess what? They all had ambulances. They all had payroll, and they all had to collect money.
Exactly.
It's not, this instance, So we are
Right.
we're held by a private equity firm, KKR. We're now the largest ambulance service and air service in the country. We've integrated with AMGH. So the air evac guys are our brothers and sisters now.
Didn't know there.
Yeah, I actually took my first helicopter ride yesterday.
Really?
That was a lot of fun.
Nice.
To be in the front, not in the back. Whether we're held privately, publicly, nonprofit,
matter.
we as an industry, no matter if you're a volunteer service or even government services, right? You've got an allotment of money to work with. Right. If you're government, it's tax-based. If you're private, it's insurance-based. But you've got an allotment to work with, and then have to somehow transform that into ambulance unit hours.
We can relate to a county that me and him both worked at. 2 ambulances there, and fighting over being able to make enough to live there. Now they were only paying paramedics $10 an hour because that's all they could afford.
Yeah.
But to that point though, that's all they could afford. But I sat in a meeting where on paper it showed that company had billed and recovered $4 million in income. Right, that was paid in.
But the county lawyer made.
But But the budget they gave for EMS was $800,000. Yeah. And they would not approve of new trucks or trucks online. It's like, wait a minute. Now that makes sense. You're taking it and putting it into everywhere else, which is feels crappy, whether it's unethical or shady or illegal. Right. I don't know, because those are all other defined terms. But that was the big problem and that's the problem I've always had. It's like, wait a minute, if you look at it a different way, right? We were talking earlier, like, man, I became a medic because I wanted to get out there and help people, and that's what I do. And I ended up in the position you're in now because you're helping communities now at your level, and you're helping the employees at your level, but you want to help people still. So we look at it that way. But when you look at it from a business standpoint, what you have to, when money is involved, you have to look at, there's business contracts. Is that we are providing a product, and if my product is making you this much money on this barely what I'm putting together, if you give me more money to do it well, I can then make you more money. And nobody wants to look at it that way. I sat in that county. It was a open meeting, and 2 former commissioners had retired, sat in the meeting with us, and I was stressed. I was having a bad part of life. I'll go ahead and tell you that right now. And I was making $10.12 an hour as a seasoned medic. Yeah, as a seasoned paramedic, living in the county and serving and not letting trucks shut down. Because before I came there, they would routinely shut a truck down because somebody wouldn't show up. I was like, nope, I live here. I'll work 3 shifts straight if I have to make this work. And they sat there and went, why is all this overtime? Because on paper it has to list out exactly how the stuff goes. And they were just raising Cain about the overtime, just as citizens. I mean, it wasn't anything official. And I lost it on them. I said, because I make less than $32,000 a year, I'm looking at filing bankruptcy because I'm going to lose my house, but I'm at 3 a.m. I'm saving your life, and you want to bitch about that.
They don't
get it.
It's a great point you bring up, because we deal with whether you want to call them an issue or a complaint, but when you back into the root cause of the issue, when you back into what really is causing people to complain about response time, what's causing all of these issues, you get all the way down to how the system's funded. And in this case, in every case, right, systems are underfunded. So it's no secret that Medicare and Medicaid, right, which is more than 50% of what we do, pay us less than what it is to run that service.
Right.
To run that, right? So for every transport we do that's Medicaid or Medicare, it's costing us more to run that, right?
Yes.
But so they limit that, right? And unfortunately, you've got the
And
patients
then with
take
the,
the
with
brunt of that.
insurance now, most people haven't met their deductible.
Or they
And
don't meet
can't
their
fit the
deductible, right? So
Right.
and then they become what we call self-pay patients, and then we've got to bill them, and they can't pay it. So then no one pays it, and
Yeah,
and then we got to
yeah.
keep
Then
going.
if you haven't met your
So-
deducble, it only pays 80%.
Well, even, and that's why I was getting to that was honest question I had, because at first I thought all systems worked in if you're providing service in that county, you're with the fire department, not run by it, but you can be stationed there, and that's the services I've worked in, is you can be stationed there. And then I found out you go to Stone Mountain to shift change, like, well, that's odd to bring all the trucks in there. And so I did more research, and I found out, because before I started working here at the school, my last interaction with the Dekalb County official was when the fire department still ran it. Right. And you'd have retirement stations that were in the south end of the county that didn't run many calls, right. But then you'd have the super busy ones. And then I really didn't interact with anybody through the rural metro days, and then the AMR took over. And so when I found out you're not even, well, now you're saying you're getting back into it, but when you came in, you were not at the fire departments, right?
Right.
You're now literally, you go to Stone Mountain to the main headquarters, you get your truck, which I have a great system of mechanics and everybody that gets everything ready. And the medics, God, I cannot tell you how many times at Newton County I was like, man, do I have to go out there and do it again, Tom? I don't want to check the oil. Where's my coffee?
I used to have to make him.
He did.
Before you can get your coffee, before you get breakfast, you got to check your truck.
And but you've got you have a really good system of medics walk in, they get their gear, the tablets went out that they need, hand it to them, go to their truck, and within 10 to 15 minutes, are pretty much ready, and they're on the road. But then they got to drive the 20, 30 minutes up to the north end of the county or wherever they're being stationed. And you sit in your truck all day, which is not horrible, but not ideal.
Right, and we've got to be incredibly efficient. We've got to be able to predict where we think the next calls are going to land and get as close as we can. We are, dependent upon our fire partners to get there quicker and buy us, that time. But it's come down to how efficient we can make the system again with the money that we have in the system.
I know we can, I've been watching the feed, and I was expecting through the day that we would probably have a lot of people coming on here complaining about.
Right. I actually asked
AMR.
for complaints halfway through.
And nobody is. Everybody is supporting AMR for the most part. I haven't seen hardly any complaints come up. Matter of fact, one I've got here says our response times are great for the most part. We all know this is Dunwoody playing politics. Maybe publishing our response stats would help.
And that's something I actually mentioned to you directly, and I mentioned on the last show I talked about this, is that part of the public relations combat is truth. Mm-hmm. And are you guys going to consider putting it on a page?
Yeah, and that's why I'm here today. And
didn't this area go from not being a city to being a city?
Dunwoody?
Yeah.
Oh.
I mean, within the last 10 years, I think they have to go through and they became a city, and then
they did get their own fire, and then they got their own police.
Mm-hmm. So now it's like they're okay. What can we do next? It's almost like a power grab, playing politics. Because I haven't heard Lithonia complaining about your response times. I haven't heard that.
Well, honestly, it'd be the
Clarkston or
fire chief of
that.
The fact that the fire chief of Dekalb County, essentially, according to the news report, essentially stepped up and defended you guys at the Region 3 Council, saying it's a bad contract. He threw out some numbers, but he basically said we're happy with Dekalb as a whole. I mean, with AMR as a whole. That's where the complaints would be, and that's actually something I told you directly. Was honestly, if you got the worst response times, then they're going to come in and take stacks of paper of proof. Because it's all public record. Right. Response times can be easily accessed through requests. And they could just come in and drop stacks of paper on the table going, they're horrible, get rid of them, and then it would have been done. But that's not the case.
Right, and then, what's horrible? So, while I appreciate, the chief, like you said, defending, it's more of just stating the facts.
Well, it is, but yeah.
And then, appreciate the Dunwoodies of the world advocating for better service.
People.
We all want a police officer and ambulance at every corner, and we'll fight until we get as close as we can. Certainly
but they don't want to pay for it.
If they want to, that's fine. A lot of the other, to your point, you asked, what happened to the other cities. I've had interactions with the other cities. They understand the system. They understand that there's a first response system and an ambulance transport system, right? So they understand that actually my patients are getting cared for. Okay, Every once in a while, they have to wait longer than they wanted to for an ambulance because it's 5 o'clock on a Friday, and we get that, but they're being cared for. In these cases that are severe emergencies, these cardiac arrests, and I've told you one story before, but we're making a difference. Our crews are making a difference. The system is not completely broken.
Two is that care awards. Apparently, y'all are getting a lot of those for the great job
What's
that
a
you're
care
doing
award?
in Dekalb County. Not sure. I think it's probably from where they had a cardiac arrest save or a stroke save or something like that.
Yep. So cardiac arrest survivor rates, all the clinical important pieces of what we do. We're meeting the clinical, and that's always a concern. Like in South Fulton, when we lost that, one of my biggest concerns.
And I wonder why the
quality.
news isn't publishing that. I mean, because that's making a difference in those people's lives. There's a lot of people that. Because I'm thinking back, I remember back in the day where Dekalb County did not have 50 ambulances on the road. When DeKalb had it, when CARE had it, when Rural Metro had it, there wasn't 50 plus ambulances out there. There's no other service in this state that could put that has 50 ambulances. Maybe I don't know how many Gwinnett has. Gwinnett has a lot. They're huge, but they're fire based as well.
Right.
So.
Yeah, and and the beauty about having corporate structures, we've got the resource to do that. If we need to, like I said, spin up DeKalb in 30 days, we can do that. We're the contractor for FEMA. Matter of fact,
I saw your FEMA garage. It's huge.
in DeKalb County, DeKalb County houses our FEMA fleet, proudly we were able to deploy that during the hurricane season last year.
Nice.
It says CARE stands for the Cardiac Arrest Registry for Enhanced Survival.
Yeah.
Is that governed by somebody other than
I know
AMR?
the state has a
state
complete
registry.
agency
Okay.
that keeps up with
That's
that.
all I'm asking is it a, because,
It's not just
Tom,
an
you can
AMR,
make
yeah.
hey, I care award, you're great, and just hand it to me. But if it comes from an outside agency, that carries more weight. That's what I was
and we
asking.
know our CARES data across the state of Georgia is higher than the average across Georgia.
And
Nice.
and you're required to report that.
Yep, we are.
Okay.
It is a requirement for reporting, data reporting.
And as our staff becomes more and more seasoned and experienced, that data continues to improve. And that's we in certain circumstances we don't advocate for change where it's not needed, because you can't forget the quality of care that's being provided on the scene. I get how important it is to get there. I think what people are missing is what's going on when they're on scene. Are they really taking care of the patients? Are they really treating them? Are they really making a difference? And these guys are. These guys, we have folks that are coming out. We had a gentleman I think he was a 50-year-old gentleman in a cardiac arrest just a month or two ago. Drop it in the middle of work. So the system worked. First responders were on scene. The ambulance got there in a reasonable amount of time. He's discharged today, having dinner with his family. I mean,
Nice.
That's what it's
that's the
about.
quality of care that in a mature system, while there is room for improvement, the folks within it are mature. And again, couldn't be more prouder of the folks that work for us.
Awesome. The only last question I have, and I don't know if Tom will have another one or Facebook, because we are getting kind of towards the end of our time, and we definitely appreciate you giving your time to talk about
Appreciate
this.
you having me.
I'm going to ask it from my standpoint because I realize I'm not trying to put you on the spot, and I know there's corporate stuff you can't possibly talk about, whatever. Would possibly part of the alleviation of the problem would be to pull out of Dunwoody and let them have their own ambulance service? Would that put more resources back into the county to help with other response times and let them handle that area?
Well, I can't answer that because I haven't seen a plan.
Well, that's true. There has been no plan.
Right.
Just in general.
Right.
I guess
So
what I'm
making
thinking.
a change for the sake of change, I don't think I'd ever support. If they showed a demonstrable plan that shows resources that can be better and actually, meddle in people, absolutely. Then I'll speak to that and let you know what I think.
Sure.
But at this point, in the absence of a plan, there's no better solution. Nor do I think putting it up there and seeing if there's something better and opening it up is a solution either. That's a gamble. So we're not, I've been speaking to a lot of folks about this. We're not in a place to put a gamble on Dunwoody or DeKalb County. We're in a place where
Yeah.
we've got to enhance and provide solutions.
Well, gambling's always bad.
That's always
you
bad.
know.
Yeah, and it's addictive.
Yeah, and I see this got pinned. This is actually a good question to end on. Can you expound on AMR's plan to continue to provide quality service despite, one, low percentage of collection rate amongst certain counties, and then it says, two, Palmetto Medicare decrease in payment percentages in October. So that plays to the making a profit or keeping things in business of, I didn't realize y'all are pulling in less money and doing more work at this point,
Yeah,
it sounds
absolutely. Yeah, absolutely. Yeah. And again, we're not complaining about that. I think
No, obviously, you haven't mentioned that while somebody else brought that up.
Yeah, yeah. And so we've just got to find ways around it. There are things we can't change. So looking at MIH programs as a solution, right? Making the system efficient and more economical. Nurse navigation lines. Georgia Medicaid just approved transportation for Medicaid patients to urgent care centers.
Oh, that's going to be a huge deal.
That's huge. When you look at the high percentage of Medicaid, those patients need help, and we are, like I said before, the first access to the healthcare system for these folks. So are we doing the system favors by taking them to an ER? But now with these progressive thoughts by Georgia Medicaid, we can now begin to change the system. So again, I see great changes to come. I think we're in the midst of a lot of new opportunities for improvement, whether it's Georgia Medicaid doing stuff, the MIH program, some of the insurance companies are stepping up and doing things differently. All this comes to play into the next iteration of what DeKalb County EMS looks like.
Awesome. Tom, you got any other questions?
No.
All right. Well, I want to say one of the biggest points for me is the only way to come up with solutions is to come together and talk about it. And that's something that Terrance has been talking about all day today, is that it's easy to point a finger and raise Cain about, this one thing is not working and blah, blah, blah. What we need to understand, as is what we teach our students as EMTs, advanced EMTs here, and then of course you can get medic elsewhere, but as all of us in the field, is the first thing you learn about medicine is the patient might complain of chest pain, but then it turns out they got shot in the stomach. You got to actually dig down to what the facts say and what the truth is. And the only way to fix this system is to have the regional EMS council come together, the counties to come together, the fire chief, everybody that's involved, the hospitals, to all come together to come up with solutions, because honestly, AMR is not going to be the end-all be-all answer to everything. They can't be. Because when you're only a part of the machine, you can't turn the whole boat. It takes a team. So we do have classes coming up, and this is the thing we talk about all the time: is ignore the emotions, ignore the yelling and the in your face, and find out what's actually going on with the patient. And if you want to learn that, you can come here and learn that for EMT. We got an EMT class coming up. September 18th is when that orientation starts. If you are an EMT and you want to become an advanced EMT, you can do that by coming up on September 13th. All the registrations on GeorgiaEMT.com. That is not on our video right now.
We got the man right here saying that they're hiring.
Yeah, and they do. They hire
time.
EMTs, they hire advanced, they hire medics all the time. So there is that. Again, Terrance, is there anything you want to put out, like where they can, you don't have to put out where they contact you, but is there anything you want to put out where they might contact you or anything?
Like I said, AMR.net. I am on Facebook. I think I like this page. And
cool.
And I just want to leave with one thing. With all the negative media that we hear about what goes on in the ambulance services, I don't want that to take away from the job that our EMTs and paramedics do on the street every day. These guys go home to their families and turn the news on, and may have had a great day and 3 saves, but have to watch something like this.
Yeah.
I want to make sure that everybody knows these guys work their tails off. They save lives literally every day, and we couldn't do it. All of us couldn't do any of this without those folks. So thank them for what they do.
Absolutely.
Yes, and thank you for coming on and saying that. And I want to thank every one of them too, because without them, there'd be countless lives lost, and they do make a difference. And it doesn't feel like it sometimes. Whenever you're that cog in the wheel and you're coming to work every day, you don't feel like you're making a difference sometimes, but you really are making a difference. You don't know. You transport that child to Eggleston, seems like there's nothing wrong with them. You don't hear nothing else about that kid ever in your life. But sometimes it ends up being that ER transport helped that child find out that they had cancer which helped them get treatment sooner,
Yeah.
which saved their life. Not an emergency at that moment that we think, but it was an emergency. We just didn't see it. And everybody out there needs a pat on the back. And here's the main man giving everybody a pat on the back. And thank you for doing that.
Thank
Yeah.
you for having me, and appreciate it.
All right. Well, for Terrance, myself, and Tom, I do this show every Friday afternoon at 2:30 ish, because it's not always right on the dot, but right here on Georgia Institute of EMS. Facebook.com/Georgia Institute of EMS. We try to dig into the matters of the day and the life. It's called the EMS Underground because it's about the life of EMS and the things that don't get talked about. And that's what we do here. So you can tune in next week. And again, call us if you have anything for schools. You can kill the audio and send the logo.
Let's get it.